All right, welcome back everyone to Healthcare Trailblazers. We're very, very happy to have a very exciting guest today, Spencer Solomon. Spencer has done many incredible things in his thus far career, but something very interesting, he built up a very successful healthcare organization in Texas with 11 locations and actually ended up successfully exiting the company and selling it to a larger corporation, which is an incredible story. I've known Spencer for a number of years now. He's very well informed and intelligent person, and I'm very excited to have you on. Thanks for coming by, Spencer.
Thanks, Mendel, for having me.
Yeah, absolutely. So we'll jump right in. So Spencer, you're not only a healthcare executive, but in a previous life, or even your current life, you are actually an attorney, right?
Yes, I'm still licensed attorney in the state of Texas, and I had a very kind of abrupt jump out of private law practice into healthcare around 2016, as you know.
Yeah. Yeah. So let's kind of take it back to law school. When did you decide that you wanted to go? What was intriguing to you about becoming a lawyer?
There was nothing intriguing to me about becoming a lawyer. It was lack of options, honestly. My wife and I went to undergraduate together in the Northeast, and I was an English major and a medieval history minor. So, there's not a whole lot you can do with that, as I found out in my senior year. So, I actually was planning on going and working in advertising. And then my wife, who was then my girlfriend, said, no, don't do that. You don't want to do that. I'm moving to Texas to run my mother's medical practice. My wife at that time was a business major. And so she said, I'm moving to Texas, to Houston. Why don't you apply to law schools down there? And then you can go to law school and become a lawyer. And I said, okay, well, I might as well just at least apply, right? So, and then I ended up getting into South Texas in Houston, and the rest is history, really. But it was really her suggestion. I was like, I don't really want to do that. That doesn't sound fun. And if I'd gone another direction, I would have stayed in New York and probably had a career in advertising or something similar.
Yeah. Wow. And yet you stuck through and you graduated and actually became a practicing lawyer.
Yes, I actually enjoyed it very much. My law school is kind of a small law school in Houston. Actually, it's a funny story because when I applied, we were already past the deadlines to submit applications. That's how much on the fence I was about going to law school.
Wow.
And so my options for where I could go were very limited. We're limited to schools that were accepting late applicants. I think it was U of H and South Texas were my only options. And,
okay.
And then I got waitlisted at U of H. So so that the rest, ended up at South Texas. But it's a great law school actually in Houston, and very, very undersung or unsung. It has one of the best advocacy programs in the country. I don't think a lot of people realize that because it's not that high in the rankings academically. But they win tons of national championships in their advocacy program and mock trial. Yep, appellate advocacy, which is appeals to fake appeals to the Supreme Court. They do an amazing program, and there's a lot of really excellent trial lawyers and appellate advocates that come out of South Texas.
Wow. Well, we'll try to reach out to them and see after that if they could sponsor this episode, because that was
yes.
quite the, so what kind of law were you practicing after graduation?
Yeah, so I graduated from law school in 2008 in the middle of a recession, right? This is right when the recession started. I was lucky enough to have secured a federal judicial clerkship with a bankruptcy judge named Judge Jeff Boehm in Houston in the Southern District of Texas. And I clerked for Judge Boehm for 1 year. And then I applied for jobs. But again, this is, end of 2008, early 2009, and all the law firms had hiring freezes.
Wow.
So I really had trouble finding my first job, and even coming from a federal judicial clerkship, which is, usually fairly, prestigious, and you're able to get you should be getting offers from large law firms, but that was not That's not how it worked in my case. I was really struggling. I was lucky enough to get a position with a smaller, commercial litigation firm in Houston called Johnson DeLuca, and that was my first job out of
Okay.
my clerkship.
Wow. And so you get your first job. How was that? What were you like? What were you actually busy with? What kind of cases were you taking on?
Yeah, so this is like a good lesson for all young lawyers out there, or folks who want to go to law school. So there are two pathways, right, that a lawyer can walk after they graduate. Actually, there's a couple different pathways, but the two main pathways are: you can go work at a big firm, assuming that you have the academic credentials, et cetera, to get a position with one. And if you go take that path, in my experience, and looking at my classmates who went and walked that pathway, for the first 4 or so years of your practice, you're going to be carrying somebody else's briefcase.
Okay.
I mean, you're not going to have a lot of personal responsibility or autonomy on the cases that you're working on. You're going to be doing what the partners are telling you. You're not going to be involved in too many client face-to-face meetings, right? You're going to be a workhorse, billing hours, et cetera. So and everybody wants that job. That's the funny part, is that's when you come out of law school, every single student almost wants that job, because the salaries can be very, very high.
And because they watch Suits, right?
And because they watch Suits. Well, see, if you watch Suits, then you should not take that job, because
Right.
that's not how it is in a big law firm, right?
Yeah.
So it's not that exciting. You're sitting at a desk for most of the day, and you are billing hours. You have your hour quotas for the year, and if you want a bonus, you better be sure to hit those quotas. So I had the other experience where I went to a very small law firm, where as soon as I got there, they were giving me full cases and saying run with it.
Wow.
So I ended up, I worked with one of the lawyers I worked with was named Don Gould. And Don Gould, he represented a lot of clients that are auto dealerships here in Texas.
Okay.
And so there were the litigation that he would handle would be these lemon law cases, where there would be someone would buy a car at a Toyota dealership or what have you. That person would then the car didn't work too good, and they would go and they would sue the dealership under the lemon laws, which is these laws that where if you sell somebody a car that doesn't work off the lot, you can be entitled to remuneration, et cetera. So,
Yeah.
These were cases where you had to go down, drive out to JP court, which is, the lowest court in the land. This is like where people fighting over $5,000, debts and things like that. And,
Wow.
and so, and I was going out and, doing hearings on these lemon law cases, a few of them. And then we had we had some other clients in other areas, but it was a lot of going to court, with zero experience. And I remember, in one of my first hearings was a discovery hearing in state district court in Houston, and I was freaking out. And I remember, and I had no lawyer, I had no partner going with me, no experienced lawyer, no co-counsel. They're just like, go down to court and handle this hearing. And I remember planning, sitting in my apartment and planning out exactly what I was going to say on this very small, in retrospect, discovery dispute over the company didn't give us the documents we asked for. We didn't get the complete set. And so I went down to court, and I had this whole script planned out. It was very formal. And I stuck to the script, and I gave this whole, diatribe to the judge. And it was went on for 15 minutes. And eventually he just stops me. He says, son, take a breath, just take a breath and just tell me what you want. And I said, oh, what I want is these 4 categories of documents. They didn't, produce them to our satisfaction. And, we think there's more that are being withheld. And he said, there you go. That's all you have to say.
That's amazing.
Yeah. And he was and it was a humbling experience, but also, it reminds you that, it's all these, they're all just people, right? The judge is just a guy, he probably lives, not too far from your house in the suburbs. Like the other lawyer is just a guy, and we're all just people talking at the end of the day. And so, that's one of those lessons that you learn as if you are a lawyer and you're given the leeway to kind of run your own cases and get out there very early. because from that point forward, it all became a lot less scary to me,
That's an
because
amazing lesson.
all the magic comes out of it, and you realize, I'm just convincing this guy that I need some documents, and like
From the other guy. Yeah.
Right. And trying to explain why the other guy's wrong. So what's
Right.
the most effective way to do that, just from a psychological standpoint, and so that was a great experience. And I hope more lawyers, have that experience early on, where they're able to work for a small shop or a nonprofit or something, coming out of law school, because it's extremely valuable, and it gives you a good it level sets you on what it is exactly that we do as lawyers.
That's awesome. Lawyers out there, pay attention, So how many years were you, so let's talk about that transition over to jumping in over at the healthcare organization. So how long were you practicing strictly law, and then what initiated that transition?
So I practiced law for 8 years, I guess 9 years if you included my clerkship. And that was in private practice. I worked for several different law firms, mainly because my wife at that time she had been accepted into medical school, and she was jumping around. So she, we lived in Houston, and then she went to medical school in Dallas, and then she did her intern year in Fort Worth, and then she got her residency back in Houston. So, I loved working for all the firms that I worked at. Johnson DeLuca, I was only there for a few months when I had to go, move to Dallas because my wife was in law school there, or rather medical school. And then in Dallas and Fort Worth, I practiced with another small shop out there. And that's when I really started doing more kind of bankruptcy, corporate restructuring, and litigation in federal court, right, in adversary proceedings and bankruptcy cases, et cetera. So, because that was kind of a natural fit for me, having clerked for a bankruptcy judge, and did that for the remainder of my career. When we moved back to Houston, and my wife attended her residency program there, I continued to work in the bankruptcy sphere, and actually it was really, really fun, because one of the partners at the law firm I was at in Houston was a Chapter 7 trustee. So these are guys that and women that are appointed by the court to administer Chapter 7 bankruptcy cases.
Okay.
And most of these cases are, small consumer cases, individuals file in Chapter 7 to get out of, paying their debts, et cetera. But those aren't the cases that I would handle, because the trustee could usually take care of those on his own, wouldn't need outside counsel. So the cases that I would handle for the partner at my firm who was a Chapter 7 trustee would be kind of the bigger cases, right? The corporate cases. And I started practicing more in the area of, hospitals and healthcare. So one of the largest cases that we had, and I was appointed lead counsel on the case. This was my claim to fame, when I was a practicing lawyer, was this case of Dr. Michael Brown. You, from being from the Northeast, you probably don't know Dr. Michael Brown, but anybody in Houston knows who this person is. He is a hand surgeon from Houston who was extraordinarily successful. And he built, a large medical center. He had surgery centers all throughout the Southwest. And he was, a multimillionaire. I mean, this guy did really well, but he had a lot of personal demons, right? Okay. And so, his bank, he was involved in a very contentious divorce with his then wife. And so that kind of led him to, okay, I'm going to file a Chapter 7 bankruptcy to kind of short circuit my divorce case. That was not a smart move. I don't know what lawyer told him to do that. But anyway, then now he's tied up in this bankruptcy, and all of his assets are tied up in this bankruptcy. Boy. And there's a trustee now looking at all of this and saying, hey, you have creditors coming out of the woodwork telling me that you owe them, hundreds of millions of dollars.
Oh, wow.
And so, he couldn't escape. And the case ended up in Houston, and I ran point on behalf of the trustee. But, we had, as part of that case, we had to administer a large, all these medical centers. And so that was a really great experience. And that was actually my first window into healthcare and how it works, And then following that, I had a number of cases where I represented trustee, both Chapter 11 and Chapter 7 trustees in hospitals that were floundering or had already closed their doors. And so I had a little flavor for healthcare, I guess, by the time I exited private practice. And that was very helpful as well in dealing with, Medicare and understanding, where the guardrails are, right, for a healthcare organization is, what you don't want to do, for example, is ever get sideways with Medicare on anything. Like, you don't want to have any billing issues. Yeah, you don't want to overbill. These are the kind of things where Medicare can turn off your funding. They can turn off your
business, essentially.
Yeah, your business effectively, because if you lose your Medicare enrollment, that puts you in breach of all of your health plan contracts.
Oh, wow.
Right. So if you have a contract to see patients with Aetna or Blue Cross and you lose your Medicare enrollment, all those contracts go away because those are conditional on you continuing to be able to work in the Medicare program. So and they can also do a lot of times what you see in these bankruptcies are large, what they call recoupment claims, where the CMS says, hey, you overbilled us for the last 6 years, and we're going to turn the faucet off and recoup. You can continue to bill, but we'll basically pay ourselves back the money that we believe that over that period. And that means you can't make payroll. And that's how all these hospitals went under, is these large recoupment claims. At least the ones that I represented.
So, we talk a lot about in all these conversations, and you've mentioned a couple of these points, and there's some other points that you and I have talked about months ago. But in general, the idea of, along your journey, these different stops, your law career, and then, then your second stop, so to speak, building out this healthcare organization, and you take certain things from each of those stops and you carry it on to the next, and those principles and fundamentals that you pick up really help you with the next experience. So you mentioned, from the law perspective, I remember talking with you from an HR perspective, talking about how you being in depositions, you learned people, you learned how to look at somebody and know if they're lying, if they're truthful. And I found that fascinating. I in general find that fascinating because I think it's like a certain superpower. It's a certain sense to be able to sit somebody and know, more than just what they're actually trying to show you.
It's a muscle, it's the reason that lawyers, especially trial lawyers who do this every day, get really good at reading people, because they're constantly interviewing and they're constantly taking these depositions. And so, you do 100 or 200 of those, and you start to notice, trends, right? So when when people look down this way, if you can hear in someone's voice, if by the inflection in their voice, whether they're being 100% truthful, whether they're holding something back. It's not foolproof by any means, but you definitely get a sense for it, and it's a skill. And I think it is one of those things that's extremely valuable in life, right? Even in your, personal life, like being able to read people well, and, understand their, what drives them and, what motivates them. As you say, in the HR context, that is the entire skill, right? Is reading people, developing, advancement plans around people based on their personal preferences, what they're good at, and their skill set. So yeah, absolutely. I would say, that's one of the things that is most valuable in practicing law for a little bit is getting that sense.
That's really cool. Let's jump into the actual healthcare part of your life. So you start, you get involved with this organization with additional members of your family. And where was the organization holding at that point? I know, like we mentioned earlier, it grew to 11 locations and dozens of providers. There was
we had over 20 providers by the end. So it's in. Let's just go back for a second, because this is the part of the story that I think will resonate with some of your listeners. Is this whole idea of changing careers, because it's very scary. Especially, when you're young and, you're like a licensed professional, like a lawyer or a doctor or an accountant, where you have, gone to school for many years learning a particular trade, right? And it's to decide, I think I'm going to go another way, is a humongous life decision, and it's quite scary.
Yeah.
Because you're jumping into the abyss. You never know what's going to be, on the other side. And so the way it worked for me is, and this goes back to the human resources aspect. I have, as I have 3 children, right? 3 small children.
Yeah.
I have a 10-year-old, an 8-year-old, and a 4-year-old, and they they were taking up more and more of my time, right? And I wanted to spend more time with them. And so, as I sat at my desk as a lawyer, I'm an 8-year lawyer, getting close to, the making partner at my law firm. I had to make a decision, do I want to keep working these long hours, or do I want to, maybe take a pay cut and spend more time with my kids, at a time in their life that, I'm never going to get back. So if I don't do it now, I knew I wasn't going to, it was going to pass me by, and that would be the choice that I made. So I decided, I remember it very clearly. It was like the very end of 2015. I had the practice that I ended up managing was owned by my mother-in-law.
Okay.
And her husband, right? I mean, he's not a physician, so he couldn't technically own the practice, but they owned it together, right? She's a family medicine practitioner. His name is Dr. Fanny Ramirez.
Amazing doctor.
Yeah, incredible person generally. Yeah. I mean, she's just what she's accomplished in her life. She's Colombian, and they fled Colombia in the 80s to get away from a lot of the violence there. And
wow.
These are folks that have seen people murdered, seen dead bodies, in the street, and so she, was a doctor in Colombia. She moved to the United States, had to restart her entire medical career and get licensed here, and then worked for Enron as the in-house physician at Enron. Enron then collapses, right?
Oh,
so
boy.
She loses her job. Right? Exactly. I mean, it's just the story there is unbelievable. She loses her job at Enron and decides to start her own practice, and builds it from one clinic, back in early 2000s to 11 by the time that we sold the practice. And so I remember sitting down with her and her husband Gustavo, and at the end of 2015, and I said, because I had represented them on a bunch of their acquisitions. They had acquired three other practices and absorbed them into their medical group, right? So at that point, there were about 4 clinics.
Okay.
And so we sat down at dinner, and they were telling me, oh, we're getting so big at this point, it's getting difficult to manage. What would you think about, coming to work with us? And I remember, and I said no for the longest time. I was like, no, I'm good, and thank you so much, because I knew it was going to be working with my in-laws. Just
right.
Right. So
working with family is one thing, and then the
right,
in-laws.
Just working with your in-laws, right? And so and plus it was medicine, which I had no real experience in, and so I kind of I said no for many months, and they were like, well, I guess we're gonna have to hire, a professional manager, and then for something clicked for me at the very end of the year, and I remember we sat to dinner, and I said, is that offer still on the table? And they said, absolutely.
Wow.
And I said, okay. And that was like the next day I gave notice at my law firm, and then in February I had my first day with Medicorp, my family doctor. At that point, we're 4 clinics. One had just closed, and the rest is history. It was a wild ride after.
Wow. That. How many years was it from when you started until you sold?
So I was there for about 6 years. We sold at the very end of 2020, and so yeah, it was 5 years. 5 years.
Yeah.
And we went from. Okay, so let me just paint this picture for you, okay?
Please.
So this is like, son-in-law, he's an attorney. I was working up in a big office building, on the 62nd floor. I had, it was just, swanky. It's the law firm kind of almost like you would see on Suits. It's like law firms are very ostentatious because, they need to impress their clients, right? So I go from that environment to, I remember my first day with Medical, and I'm in a suit, I'm like dressed, I'm all ready to go. not knowing what to expect. And I am placed into the second floor of a clinic that we had just acquired in the ghetto. And I'm on the second floor. It is like there are rats in the walls. I can hear the rats in the walls.
Oh my gosh.
Yeah, it's like there's nothing works. And it's like gringy. It's grimy and it's gross. And I remember sitting up there and I'm like, what have I done? What have I done?
The regret came in fast.
Yeah, it was just the contrast. But I stuck with it. I was like, you know what? I could do this. This is not, we just need to work on it. And so, it's interesting because I was originally hired only to handle their legal matters, right? So it was going to be, a compliance and that kind of thing. And they had a manager working there. And I'll never forget it. And it was like October. It was maybe only like 6 or 7 months after I started. He goes to his daughter's wedding in India.
Okay.
And he's like, I have to go for 2 weeks for my daughter's wedding in India. Can you hold down the fort, Spencer? Okay. So, okay, sure. He never comes back. And I remember thinking it was weird because he handed me a flash drive with all the passwords on it. And I'm like, why do I need this? Oh, well, just in case. So he goes off to India and never returns.
Oh, my gosh.
Then they tell me, oh, you know what? Now you're the manager of the practice. So I'm like, okay, you know what? If I'm going to do that, I need to go back to school because I don't know what I'm doing,
Okay.
So then I applied back to all these master's programs.
Did you really?
Yes.
Oh my gosh.
Because I was freaking out.
Right.
Because I had no experience, and I'm being asked to run a medical practice, which now consists of 5 clinics.
Right.
And we probably at that point had about 40 or 50 employees. And so I'm like running the payroll and trying to close new acquisitions, and you make sure that we're doing everything properly in accordance with with appropriate medical standards. And it was, and so I'm like, I go to my mother-in-law and father-in-law, and I'm like, guys, I need to go back to school. You want me to? I'm happy to do this, but I need to go get an education. And they were very supportive. They were 100% absolutely. And so I went and took and got my master's at UHC.
Wow, I did not even know.
USC. Yeah,
like USC. In California.
USC in California. Yeah.
I spent a year there. That's too funny. I didn't even know that.
Yeah.
That's so amazing.
I did that at night. And it was a great experience. They have a phenomenal program at USC's. It's like an executive master's for health administration.
Okay.
And they have another one for their MPH, Master's in Public Health. The professors, it was great. It was all virtual except for the few times we had to go to California for their in-service. But I learned a ton from that program, and that really helped me run the business. That's how I started running the business. Was
okay. So did you leave completely? Like, did you move to California?
No. It was virtual mostly.
Okay.
So I was just
you were still managing.
Yeah, I was still managing. Oh yeah, and it was such a great experience because as I am learning these management techniques, leadership techniques, I can apply all of it. Each day that I would learn, I can apply all of it tomorrow, right? So I would say, okay, this is what lean healthcare is. Okay, so let's start a lean pilot program to improve our wait times, and I would make that a case study in my course. At the same time, we would be rolling out an actual lean pilot program,
wow.
At one clinic, to try to improve wait times, right? And so it was just such a great, combination of experiences where what you're learning, at night, you can then go do it at work the next day and say, okay, let's try one of these.
That's awesome.
And we did, really cool. It really, really helped us improve.
Wow.
When I first arrived at Medicorp, like I said, I'm working in this. I'm working in the ghetto, in this office with rats and things. But we had no books, right? There's no book. The company had no books when I got there, right? We had no human resources system of any real note. Okay, we had no like our policies and procedures were just kind of like in binders, and some of them were 10 years old. I just remember thinking like, how am I going to organize all this.
Wow.
We had no website, we had no marketing. Yeah.
Yeah, I think there's really something here in the humility I think it takes to go from, like you said, swanky office, fancy suits, the whole set, to back to all the way down to rats in the wall, and then go back to school. I think that's really incredible. And there's probably, like, these people that they get their little bit of power and then they just ride that for the rest of their life. But it seems like to have the humility to actually open yourself up to new opportunities, even if they're possibly looking like a step down.
Yeah.
That's what really, I
didn't have a choice. I didn't have a choice, because I had left my law firm, and I'm certainly not going to go crawling back with my tail between my legs.
Yeah.
And so I was like, I'm doing this. I don't care. It was almost like a stubborn determination, at the beginning, when I was like, no, I'm going to make this work.
Right.
And you know what? I ended up loving it, man. I didn't realize, how much I like working with people. I think that's something, when you work in healthcare, in any kind of managerial position, whether it's a clinic supervisor or something, and you're overseeing people and making sure, everything's working well and that people are motivated and happy. And, it's very, very rewarding, much more rewarding than, for example, winning a legal case. And that's rewarding too in its own way. But there's something, at least to me, about, watching people flourish and watching people get promoted and being able to, even when people would leave our organization and they would go work for another healthcare company, and get, a higher level position. I love that. I'm like, look, we created this environment for this person to get experience. And I never felt like we had anybody burn a bridge or anything. I was always happy for people who would advance in their career, even if it meant leaving the company. I think, it's very, very gratifying to work with people in that way.
That's amazing. And that's so healthy. And just another big part of this, I think, for those listening, Spencer's, and I think this is an amazing quality that I think is really important. But Spencer, someone you don't take yourself too serious ever, and I think that's probably a big part of being able to do all that, So let's jump into you exited, you built this thing up over 5 years. Did you build it to sell? Did you build it to build? At what point did that start becoming a reality where you were saying, okay, we can exit?
So it depends on who you ask.
Okay.
Right? So my strategy was always to prepare for a sale event.
Okay.
And that is because of my training as a lawyer, right? I irrespective of whether we were going to sell or not, we needed to be ready. We needed to make the company attractive to outside investment, okay? Attractive to a potential purchaser, because that is what creates value in an organization, right? It is, and part of that is, I remember I have some friends from college who ended up going into private equity, actually from high school. And I called him and I said, what do I need to do? What would a private equity company be looking at, in a healthcare organization in terms of investment? And he rattled off all the things. He was like, you need 3 years of pristine books. You need, show this level of EBITDA, right? And so I remember, and that was very early on, and I always had that in the back of my mind, that these are my objectives, right? Of course, the primary objective on the day-to-day basis is always to take care of the patients, give them a good experience, keep them coming back, and make sure, the doctors are engaged, and that, we're creating a really excellent experience and for our patients. But, always in the back of my mind was, okay, what do we need to do this year to improve this or that aspect of the organization that would be attractive to outside investors? And so, okay. But my in-laws, and I think they were aligned with that, but I think they've really viewed it as, this is a family business we're going to pass down to the grandkids. Okay. And I never really felt that way. I didn't think, companies exist to be sold, and just the way that healthcare is with all the mergers and consolidation, it just seemed inevitable that eventually we would, if we played our cards right, we would get an offer that, we couldn't pass up. And so, yeah, I do think that it was in
So you had very clear objectives and goals that you were working towards, which is awesome. And then that became a reality. And like you said, late of 2020, right?
Yep, it became a reality. So we I don't know what happened well, obviously I know what happened. 2020, we had a gigantic pandemic hit the globe.
Right, true.
And so it's strange because we were not, shopping around, right? I mean, we were approached almost simultaneously by two large groups for acquisition, and that was in early 2020. So I'm not sure, why that was the timing. I really don't know. It might have something to do with. I don't think it has to do with the pandemic. I do think it has to do with the way healthcare is changing fundamentally, especially in the Medicare Advantage space.
Okay, you want to talk about that a little bit?
Yeah, sure. Our primary service at Medicorp, my family doctor, was seniors. So we offered senior care mainly to patients enrolled in Medicare Advantage plans, right? Okay. So Medicare Advantage is an interesting animal because it's, everybody thinks of Medicare and yes, these are people who are 65 and older who are able to enroll in Medicare, and Medicare pays 80% of their healthcare costs. They're responsible for the remaining 20%, and that's how Medicare works. Well, that's not exactly how Medicare works. So that's how Medicare Part B works, right? But Medicare Part C is the Medicare Advantage program. And what that means is you have a private insurer that will bid on for patients, for groups of patients in certain market areas, and create a product for them that will allow the patient to, in some cases, pay nothing, right?
Yep.
Or you could have zero premium plans. But the way that they do this is, CMS has what's called a benchmark for, any given patient or population of patients, right? Where they say, we believe it's going to cost us, let's call it, $30 million to take care of these, 10,000 patients next year. And they base this based on, geography, claims data, and other metrics that they use. They're very sophisticated. So what Medicare Advantage plans do, the health plans that participate in this program, they go in and they say, okay, well, CMS, this is your benchmark for this population of patients. We believe we can take care of these patients for less money, for $25 million, not $30 million. And then they kind of bid and compete on these populations, and to the extent that Medicare awards them the contract, they can then create this program, put the patients in one plan, and try to save money for the Medicare program. It's a smart idea, in terms of cost, reducing costs in our Medicare program, which is, obviously
an objective,
which is obviously, heading for a cliff. But so that's how Medicare Advantage works. And the piece and the reason that health plans like to do this is because the delta between the benchmark and the bid, they get to keep a percentage of those dollars. So if they can really save $5 million on caring for these patients, I think CMS keeps half, they keep half, and then any additional savings, I believe, are inure to the benefit of the health plan, right? Yeah. So that's what we did. Now, the way that health plans manage risk in this system, because it's risky, they're basically saying we can take care of these patients and we'll save money. If they don't save money, they're on the hook, right? They're going to lose money. So it's a gamble, right? So what they do is to try to mitigate that risk, they contract out with local networks, physician networks. They go by many names. It could be called an IPA, an ACO, MSO. I mean, it is, these are networks of physicians and healthcare providers that agree to take on that risk of loss from the health plan. So they'll say, hey, local IPA in Houston, we have, you have whatever it is, 10,000 patients assigned to you. To the extent that you guys can save money on those 10,000 patients, you can keep some, right? So now you have the health plan taking a risk with CMS on this larger population.
Yep.
And then they're farming out that risk to smaller IPAs who themselves are willing to, take that risk in exchange for, a percentage of the upside. That is how our Medicare Advantage system works.
Yep.
And so how does this tie into our acquisition? Well, the most efficient way to perform on these levels of risks, that these IPAs are taking is to have the largest number of members possible, and to have those largest numbers of members managed by physicians that you employ, right? So if you can dictate, if you have everybody on the same EMR system, and you have all the doctors are your employees, and you can set their comp, and you can set their incentive structure, and you have control over all the data for all the members that you're seeing within your one EMR system and financial system and, analytics, you can perform much more highly than if you were to just, contract out with a bunch of independent doctors and hope for the best.
Right.
This is why we have so many mergers in healthcare, especially in the Medicare, in the space in which practices operate with large numbers of Medicare Advantage patients.
Got it.
Because the only way to really do well there is to have an employed model, right?
Yep.
And so that's why they're gobbling up practices all over the country.
So you built your practice to that effect, and it happened in due time, and you were approached, and
yeah, I think it was more market forces than anything. Yeah. So it's like, the group that acquired us is, they are experts in Medicare Advantage, and they saw in us, okay, this is a group of physicians that care for seniors, that have good processes in place, that understand the business. So it won't take very much for us to, convert this over to our model. And so I think that's what made us attractive. But of course, any practice with large numbers of Medicare Advantage patients for which the IPA is at risk is going to be a very attractive acquisition target, irrespective of how they're performing, because of the membership that's attached to them.
Yeah. Well, we're really we're running short on time here. These talking with you, the time just flies so quickly, and now you're on a whole nother journey, which is now you've exited and you've started kind of the next chapter, working in a very, very large corporate organization. And wish we had more time to dig into that. Maybe down the road we'll have to do a part two.
Well, I can tell. I gave you my very short, assessment. So going from working from a family-owned business where I was, largely completely autonomous, right? I didn't really answer to anybody. My in-laws were very, very easy to work with. And to going to a large, Fortune 500, healthcare company has been jarring, extremely jarring. I've never worked for a big company before. It's I think they're definitely highly sophisticated at a level where I couldn't even have imagined that the organization, the use of data that happens at such a high level. It's astonishing. And so high degree of sophistication. And the tools that they have are just things that we could never have afforded, frankly. And so that part has been amazing and a tremendous learning experience. The thing that it's going to take some getting used to is the bureaucracy, politics, needing to CYA, and I'm okay with that because I'm a lawyer. I have that ability. I remember, working at a law firm and having firm politics, but it's been a while. So I'm still adjusting to my new role, and I'm usually pretty quiet. I try to be quiet in meetings unless I know what I'm talking about. I try to make sure I understand who's on the call and who so I don't put my foot in my mouth. So. That's about the best I can tell you, but I'm still going through it. So yeah, if you want to have another conversation a year from now, I can give you the full 411 on it.
Yeah. Well, I look forward to that. Thank you so much for spending some time with us today, and look forward to chatting in the future.
Thank you, man. It's been a pleasure.